Good morning. Today I'm going to introduce you to this charming lady. She has been suffering from knee pain for a long time. She had an injection of hyaluronic acid previously, which didn't help. That was back home, and now she has come here. And she approached me 1.5 months back, but because of various other constraints, she only turned up in my office last Saturday. I did the procedure for her on Monday. The procedure was a bilateral or both knees platelet-rich stroma treatment. As you know, platelet-rich stroma is a combination of platelet-rich plasma and stromal vascular fraction. And today is 72 hours after the procedure. I did it on Monday. Today is Thursday. I removed the dressings. The wounds are all well healed. In addition, for post-operative pain relief, I also administered her nerve blocks, genicular nerve blocks. That is to numb the nerves, 3 of the nerves supplying the knee. We cannot numb all the nerves, so I numbed 3 of the nerves. As a result of that, she felt extended pain relief, but later on in the day, as the nerve block wore away, and she experienced pain, but by the next morning, that is on Tuesday morning, the pain started to ebb, and she's been mobilizing at home. In fact, she has gone to visit another hospital for some other purpose, and here she is today. So we'll listen to her. I'll introduce you. Can you kindly introduce yourself?
Yes, hi doctor. My name is Sandhya Ramaswamy and I live in California. And I've been wanting to do this treatment for a while, and you came highly recommended. And so I'm so glad I did the treatment. Yes.
Narrate your activity level, what are the findings, and when were you experiencing knee pain?
Yeah, so I used to be very active. I used to do a lot of yoga and I used to jog. I think my osteoarthritis of the kneecap, which I got diagnosed with last year, bilateral, both knees, I think came about because of wrong postures and hyperextending my knee instead of using my thigh muscles. And I don't think the jogging helped. And as you confirmed with your cardiogram and MRI, there was just a lot of cartilage loss.
Under the kneecap.
Under the kneecap.
And the bed of the bone, that is the trochlea.
That's right. That was a new finding that you educated me on.
And also the inner side of the knees.
Right. So, I mean, I've been in pain for the past, even though I'm 53, I feel like I'm in as much pain like my 84-year-old mother who has osteoarthritis. And so it's been a shock. It came as a shock. It has been debilitating. So I decided to do something about it. Yes.
What was the procedure? How was your experience of the procedure up in the operating theatre, the anesthesia,
oh my God,
and the recovery?
Yeah, of course, spinal.
This is your first operation?
First time being in an operation theatre.
You were petrified?
Petrified. When I heard spinal anesthesia, of course I googled it and saw what could go wrong. It was a non-event. The anesthesiologist that you partner with was like really gentle, and he said it'll be like a pinprick. It was like a pinprick. And you actually showed me the diagram, or you had written down based on my MRI where all you were going to inject, right? The substance, my fat cells and the PRP. And so that gave me some confidence as well. And I was out of it, that numbing started in seconds? And only afterwards I realized you showed me you took fat from my thighs. None of that even registered. So the procedure, I think, went really, really, really well. Yes.
And then you went home the same day, later in the evening?
Same day, later in the evening. When the analgesic started wearing off, yes, I started having pain. And then I was on the pain reducers.
So you had that, not in addition to the pain reducer, you had the special cryotherapy?
Yes, special cryotherapy. That's right. 2 times a day. That day,
the machine,
and then 3 times following day, which compression plus cryotherapy. That was really good and helpful. Significant changes, like with my parents' notices. I'm here supporting my parents in their retirement home. I'm here for 2 months, and my dad, he noticed such a big difference between the first day and the second day. First day I used like a walker just to get around. The second day I didn't need it.
Today is the third
and
day.
third day, today is the Monday, fourth day actually. Yesterday more improvement, and then of course now you remove the dressing, and we've seen what the improvement has been already. So.
How are you able to walk?
Oh, much better, doctor.
Both legs were operated. Procedure
Yes.
was done. I won't call it operation. Lift your leg.
Yes.
Walk back.
It's really made a world of difference.
Ah.
I'm able to walk now without any.
You're able to walk now?
Yeah,
Without any aids. How did you come into the hospital today?
I came in a wheelchair, yes, and I have my stick.
And you have your stick.
Walking stick.
Where's your walking stick? I'll cut it.
And I'm walking without the walking stick now.
Though there's the walking stick, and now you're able to walk without.
Yes.
You have the confidence in your legs now.
Yes.
Huh?
Very much so.
How's your pre-operative knee pain? The pain which you used to experience under your kneecap while walking, climbing stairs, and all that.
I haven't climbed stairs, so I can't say.
But
about
standing
that.
in one place.
I didn't have knee pain before, but I really am excited to see how things have shifted as I'm getting up and down.
That's important.
That's the most important.
So how's that?
I think that's pretty good. I got up from bed. I can
Sure.
sit on the bed.
Yes. Sit down on a bed and
Might still need some support to sit on the bed like that.
Okay.
Again, the bandages just came out.
Yeah,
right?
yeah.
And the healing takes 2-3 weeks.
Yes.
Yeah. So I still have to make a fist and then get up.
Did you experience any pain now?
No, maybe a slight, very little.
Shall we do some steps?
Are we doing the steps?
Yeah. How was it? Hey? Huh?
Relatively pain-free. This is just after the bandages came out today, so it's going to continue to improve, right?
Of course.
Oh, wow. Yeah, thank you, doctor. Yes.
Okay. Could you have got this treatment back in the US?
I don't. Since I got the hyaluronic acid, not acid, is it
Hyaluronic acid.
It is. I got it from my ortho there, and it did nothing for me. I was a little disillusioned. I know there is PRP. I know there is stem cell treatment there, but not all orthopedicians give it. And I think the ones that do or the ones that give treatment are very expensive, and I don't think they're even orthopedic. Honestly, I'll be honest with you. You're one of the very few orthopedic surgeons who does this. Most people who do these treatments are like pain specialists.
And here also in Chennai, also you Googled some names. What was your experience? You
they're all pain specialists, and so I don't know if I feel for somebody to do this procedure, you need to be an ortho. Right? Am I right? I don't know. Yeah. So in the US, I think it's the same thing. Like my ortho doesn't do this procedure. He only does the hyaluronic acid. So when I Googled stem cell, I found some clinics, but they were not done by orthopedics. They were done by pain doctors. So I wasn't comfortable with that. Yes.
Yeah, they have use a very basic type of stem cells from bone marrow.
Yes.
I talked to you about bone marrow
Yes.
and fat and the relative advantages of fat. Fat has got more stem cells in it than bone marrow. So that is what you got here.
And also, one thing you told me, which I was really impressed, you said you gave an injection to the bone so that the bone will help
heal the cartilage, regenerate the cartilage.
Ah, that was fascinating. I didn't know that.
It's called an intraosseous injection.
Okay.
Not just into the joint, but into the bone.
Into the bone. That was fascinating. I didn't know that bone has that capability.
A bone supports cartilage.
Okay.
They are intertwined very closely.
Very closely. And it's I only go up from here, right? It's gonna keep improving. And you did say I'll have relief for 8 to 10 years.
Yeah.
Right? So my goal is 10 to 12 years. So by then another.
So what will you do after 10 years?
Like you said, by then stem cell from umbilical cord treatment, like we'll get newer and newer treatment, more cutting edge. You said we can do another treatment, so I may never have to do knee surgery. Am I right?
Correct.
That's the hope. That's the goal.
That's the goal. And then, of course, you have issues with your blood work and all that. I've pointed out that to you and what to do.
Yes.
So take care of that.
Yes.
By diet.
Yes.
And now you'll be able to walk more and reduce weight.
Exactly. I think there was a chicken and an egg since last year. Since this diagnosis and this pain, it severely curtailed my exercise. You know, and cholesterol runs in the family. So I was very surprised to see the results. Doctors have told me, once they said, don't worry, it runs in the family, it's genetic. But then I looked at the triglycerides and the LDL levels, I was not happy. So definitely, you know, it's
osteoarthritis, now it's emerging that it is not a wear and tear disease as is commonly perceived.
Oh, wow.
It's not.
Okay.
Yeah, so wear and tear means the more you wear it, the more you will tear it. But you are, as you said, your age is on record. I have seen people with obesity. So it has to do with the interior milieu of the body, inflammation.
Okay. So diet and lifestyle is responsible for every single thing.
Milieu of the body. The more fat you accumulate, that that's a deposit of inflammatory factors.
Got it.
And that leads to inflammation in the joint.
And also, but to be honest also, because the 2 weeks before I came to see, the reason I couldn't see you, even though I contacted you a month and a half, was my dad was in the hospital, right? So the past 2 weeks were really stressful. So I forget exercise. I was able to eat only what I could on the go. So it wasn't the healthiest. I'm sure that had a factor.
Could be.
Yeah.
Could be.
But no, I'm committed to my health, and now I've done this amazing procedure and feel good.
Now people are getting yearly shots of stem cells in the US. That's a fad, you know.
Oh, wow.
And the goal amongst people who are very, very health conscious is to live forever. Get stem cells every year, be pain free, then eat the proper diet, do the proper exercise, get adequate sleep, 8 hours of sleep.
Yes.
Total good quality sleep.
Yes. Yeah. No, thank you, doctor. This sets me on a new path. There's like before and after, right? So I'm so grateful to you, and thank you so much.
Thank you so much.
Yeah.
Welcome. Have a safe journey.
Thank
I wish
you.
your father a speedy recovery.
Oh, thank you so much, doctor. And everyone, if you're thinking about it, just do it. Dr. Venkatachalam is amazing. I mean, he was there Monday. He was there here from 6 till 5:30 p.m.
Till you went?
Till I went home. So he was there every step of the way. So please know that you're in great hands with Dr. Venkatachalam. There are lots.
How's the hospital, by the way?
Oh my God, SRM Global. I told my dad, what Tamil, I will just switch to Tamil. And I'm going to get my procedure done at SRM Global. I've not seen, I've been to hospitals.
How are the girls?
Oh my God, the nurses, the sisters, the staff.
Bharati.
Oh my God, Bharati is so amazing. My God. Oh, just seamless. Everything is seamless. Blood work done like that. Like how many? We sent what, six panels for blood work. X-ray done in 10 minutes. And his partner in MRI, your good friend
Saravanan.
Miss Dr. Saravanan. Saravanan scans the MRI, cartogram. Didn't even know about cartogram. What Dr. Venkatachalam has is much more advanced than what they do in the US. I don't even know if they know about like cartogram. Like my MRI was like 10 minutes back there in the US. Here it was like 45 minutes per knee because it mapped out exactly where my cartilage was.
And the treatment is based on that.
Yes. Oh yeah, so it was very important. So thank you so much,
Thank
doctor.
you so much.